Rural life doesn't suit everybody. Not choose any place else. But I do get frustrated with the limitations we have in caring for those in our community. When I decided to become a sexual assault forensic examiner 7 years ago, there was nobody else in Lake County to do this kind of work. My name is Cindy Forbes. I'm an emergency department nurse at Sutter Lakeside Hospital in Lakeport, California. I am the sexual assault response team coordinator for my hospital. Being in a very rural community, each of us has to wear many hats. So I'm also responsible for trauma, pediatrics, and pre-hospital care. We're all busy all the time. Our resources here are very limited. Our population is very challenged, and I can tell you that if my victims aren't getting rape exams here, they aren't getting rape exams.
The Hopi population believes strongly in their cultural and traditional beliefs, which plays a role in how grateful they are for what they receive. For me as a nurse, my patients always come first. Being able to make a difference, being able to give back to my Native people, to give back to the community I came from, is a big part of why I do what I do. My name is Elise Sage. I am a clinical nurse at the Hopi Healthcare Center in Palaca, Arizona. I am also the SANE coordinator for the Hopi Healthcare Center. Coming from a small community, everybody knows everybody. Hopi's no exception to that. Walking down the street, you may see a patient you saw the other day. That may be a reason somebody doesn't come forward. Maybe they don't want anybody to know what had happened to them. Having another nurse in the room who's not from the community provides a great sense of relief, of comfort and security in knowing that their privacy is number one.
Sexual assault patients really do need a specific type of care. I spent over 20 years as an ER nurse, and it became really clear that sexual assault patients were a challenge for the ER staff. Their needs are immediate. There's just so much that goes into taking care of the patients that nurses are really not comfortable with. I'm Cheryl Ray. I am the Associate Director for the Massachusetts Sexual Assault Nurse Examiners Program. I'm also the co-director on the National TeleNursing Center project at Newton Wellesley Hospital. The primary goal of this project is to work with the remote site clinician in a really collaborative way to increase their confidence and to build their skill levels so that they feel better about the exam. Joan Sham is the director of the Mass SANE program and works out of the Department of Public Health. The two of us really came upon this grant by chance. We had a responsibility because we had such rich resources and so much expertise here in Massachusetts. It was obvious that they were trying to bring services to areas that were really very much underserved. And we knew there were sexual assault patients that needed our help.
A lot of people don't realize how traumatic the sexual assault exam is, not just for the victim, but for everybody involved in it. We all become emotional. It's hard for me to even capture how different it is doing an exam with an expert sexual assault nurse examiner in the room with us. Every time I am in that room, there is something I was going to miss had it not been for the National TeleNursing SANE pointing something out to me.
It's really crucial to demonstrate that proper technique to make sure that the evidence is collected in the best manner possible. The center is equipped with all the different kits. It's set up so that when we do get a call and we come in, we're able to pull that kit and the paperwork that the nurse is going to be using at that remote site, and we're able to go step by step with them so that we really are part of the process.
Working with the National TeleNursing Center in Massachusetts has been an awesome experience for us. We do weekly calls with them. They're our voice at times. They're able to sit there and talk with our leadership. They're able to talk with everybody, and we're all communicating as one. Making sure that we are using the proper techniques of swabbing, documenting correctly, and even checking to see if we're using the camera and getting the correct angle for a picture are the things that they help us with. They're a resource for a lot of things.
Our partnership with NTC has provided benefits we hadn't anticipated. When we finish an exam now, the rape crisis worker and myself, we feel like we did good work. We gave this person the best possible care, the best possible opportunity to heal, to be safe, to be healthy, and move forward. And we've given our law enforcement the best opportunity to have that suspect put behind bars. I know for our rape crisis workers, they are so glad when they know the victim is coming to Sutter Lakeside Hospital, because they know they're going to have that expert telesane there in the room.